Alrighty, last episode of the night, and it's actually called Half a Brain. Alright, you'll probably be able to handle the suggestion that someone remove, say, your gallbladder with reasonable equanimity. But what if someone were to propose taking out a large chunk of your brain? Much less acceptable, of course. Yet there is an operation called a hemispherectomy. Hemispherectomy. I don't know what it means, but I just can't pronounce it. I'm sorry. That removes one hemisphere of the brain, and patients can live quite well for years with just the remaining half. Obviously, this is, in a situation where it's dire, it's not like everybody needs a brain surgery. The first hemispherectomy was performed at Johns Hopkins University, of course, and the operation has since become a specialty there. I didn't know that. It's a last resort operation, usually carried out patients who suffer so badly from seizure that daily life has become impossible, and the huge majority of patients are young children, which is very sad. You can't take more than half. If you take the whole thing, you got a problem. That's what one of the surgeons said at Johns Hopkins University. Even the operation to remove half is not without side effects, although they're not so bad as one might suppose. Patients usually lose motor function on the opposite side of the body from where the brain was removed, obviously because the right brain controls your left body and your left brain controls your right body. So, self-explanatory. Many have speech problems also, but can generally operate normally in most other ways, better than when they were suffering from seizures. So, last question is, what happens to the skull space left by the vacated brain? It doesn't stay empty though. The obliging body quickly fills it with fluid, so it decreases the harm that's done or the side effects. But you know what? Like I said, this is the last resort. I'm not a brain surgeon, and I'll definitely not have a brain surgery. Take care, guys. Good night.